Hi, my name is Taylor Helms. I'm going to be presenting a clinical case of hantavirus pulmonary syndrome and Ascariasis infestation. Now, just to begin introducing patient, patient LC is a 32-year-old female. She is 68 inches tall, 118.7 pounds, as well as a BMI of 17.4. She's an archaeologist and treasure hunter who has spent the last year among Mayan ruins of Chichen Itza on Mexico's Yucatan Peninsula. She did present with abdominal distension, poor appetite, nausea, worsening epigastric pain with a 16-pound weight loss in the last 3 months as well. Newer symptoms she began experiencing more recently include cough, diarrhea, fever, general malaise, night sweats, and a rash on her lower extremities as well. So she was diagnosed with a primary diagnosis of hantavirus pulmonary syndrome, valley fever, small bowel obstruction second to ascariasis, and a secondary diagnosis of severe protein calorie malnutrition. So these are being treated with a couple different things. So they have given her a number of medications, and they conducted a few procedures as well. So when looking at the when looking at the medications, they did treat her with ivermectin, omeprazole, loperamide, magnesium oxide, famotidine, vitamin D2, which was prescribed weekly for 8 weeks, and cholestyramine. Now with the procedures, they did conduct abdominal x-rays, abdominal ultrasounds, an exploratory laparotomy, as well as a small bowel excision, which they also conducted the resection of the duodenum and proximal jejunum. Now, LC does have a past medical history of vitamin D deficiency, acute pancreatitis, secondary to traumatic injury or blunt force trauma. She also has a vitamin B12 deficiency, has a history of a pelvic fracture, Crohn's disease with past surgical history of a terminal ileal resection of approximately 70 centimeters, which was also secondary to the Crohn's disease. Now, looking at the pathophysiology of hantavirus pulmonary syndrome, it's important to look at hantavirus as a whole, which is in general is a family of viruses of which can cause serious illness and death. So the hantavirus pulmonary syndrome is a result of that, and it is spread by rodents and can be pretty deadly and affects the lungs. So with that, it is common to see the early symptoms, which typically become apparent 1 to 8 weeks after contact with said rodent. Those early symptoms typically include fatigue, fever, muscle aches, specifically in the larger muscle groups. So think back muscles and leg muscles, etc. And sometimes commonly seen, you can see some headaches, dizziness, abdominal distress like nausea, vomiting, and diarrhea. And in those later symptoms, typically you'll see that come on about 4 to 10 days after the initial onset. With that, it's common to see headaches, abdominal and back pain, fever and chills, blurred vision, nausea, and sometimes they'll see facial flushing, inflammation or redness of the eyes, as well as a rash. The late symptoms typically include a low blood pressure, acute shock, vascular leakage, as well as acute kidney failure. Now, when looking at the ascariasis infestation, so Ascariasis is a round intestinal worm infestation, which is transmitted typically by fecal, oral matter. So Ascariasis can cause pretty significant complications like abdominal obstruction, volvulus, and intestinal necrosis. So volvulus is a condition in which the intestine will twist around itself. This causes bowel obstruction, and then that can lead to necrosis. So important to note, the necrosis can come from a couple of different things, one being mechanical obstruction. So the number of worms that can accumulate in the small intestine will form a bolus, which obstructs the food and fluid passing through. When that happens, it does cause a buildup in pressure, and that will result in the reduced blood flow, ultimately leading to the necrosis. So of the intestinal walls, that is. Another thing that can cause the complications is the inflammatory response, which can cause worms to release toxins, which ultimately affects the permeability of the intestinal wall. Another thing that I think is pretty important to note, it can be treated with the exploratory laparotomy to see if the bowel is still intact. But if that bowel still is intact and the obstruction is at the ileum, then it's possible to milk the worms to the cecum. Just important to make sure that that is done very cautiously, not to obstruct or cause damage to the intestinal wall. Going back to laparotomy, it does help determine which type of surgery is the most suitable for the patient. Now, going back to which organs are involved, the lungs, the hantavirus pulmonary syndrome does cause the blood vessels of the lungs to become leaky. This results in that fluid buildup and causes some difficulty breathing. And when it comes to the heart, hantavirus pulmonary syndrome can damage the heart by reducing its ability to pump blood, which causes a low blood pressure, acute shock, and sometimes even leading to organ failure. Now, with the kidneys, it can kind of impede on the structure of the endothelial cell barrier. This causes that increased vascular permeability. So with that, it allows fluid and protein to leak out of the blood vessels into the surrounding tissue. This causes more inflammation or edema and acute kidney injury. With that, the loss of the barrier function does affect the glomeruli and can result in proteinuria and decreased glomerular filtration rate. The other way it can affect the kidneys is by causing an overactive immune response. So this leads to more of a release of inflammatory mediators, which can cause damage to kidneys, the kidney cells, and disrupt the function. Lastly, it can cause direct viral infection to the kidneys. Last thing I kind of wanted to touch on when it comes to the organs involved, the small intestine. Obviously, as we mentioned previously, pretty significantly, Ascariasis does affect the intestines, so it can cause severe complications within it, such as intestinal necrosis, abdominal obstruction, or volvulus, as stated previously. Now, when looking at the assessment, patient's food and nutritional history, she does follow a very strict vegan diet, with meals mostly prepared by her personal chef. On top of that, she also doesn't smoke or drink, so just important to know going forward when coming to treatment. As for her anthropometrics, as mentioned previously, she is 68 inches tall, weighing in, when admitted into the hospital, 118.17 pounds, with a BMI of 17.4. Now, her usual body weight is 134.5 pounds. Pretty significant amount of weight that she lost there, with her ideal body weight still being 138. So, as mentioned a couple times already, she has had that 16-pound weight loss in the last 3 months. So, very important to note. Now, when looking at the testing and procedures that were done, she did have the abdominal x-ray done, abdominal ultrasound, CT scan, the exploratory laparotomy, as well as the duodenal and proximal jejunal resection. Some of the findings include quite a number of things. So with the abdominal x-ray, there was a curvilinear soft tissue density cords, gaseous dilation of the stomach, and multiple loops in the small bowel. There were air-filled tubular structures that were apparent as well, which seemed to be projecting over the loops of the small bowel in both the abdomen and the intestine. When looking at the abdominal ultrasound, there was pretty extreme dilated loops of the small bowel as well, which was consistent with the abdominal x-ray results. And although non-peristaltic, it did show the curvilinear structures that moved independently as well. Now, with the CT scan, it was evident that there were the same tube-like structures through the small bowel. There was also a mass in the distal jejunum, thickening of the terminal ileum, which was believed to indicate the small bowel obstruction, which was secondary to the ascariasis and associated with bowel ischemia. And with the exploratory laparotomy and the duodenal and proximal jejunal resection, there was about 100 centimeters of the proximal jejunal necrotic. Ascariasis roundworm length ranged about 12 to 38 centimeters in length and 3 to 7 millimeters in diameter. So important to know. When looking at her clinical lab results, with her albumin levels, they were low, which was consistent with the malnutrition as well as the inflammatory response from her body fighting off the infestation. The vitamin D was pretty significantly deficient, which made sense since she did mention in the study that she had ran out of her vitamin D supplement while she was in Mexico. Her hemoglobin levels did show mild anemia, but nothing extremely significant, whereas her white blood cells did show that they were elevated, which, again, along with the inflammatory response and process of the infection, makes sense. Now her creatinine levels were reduced with renal clearance, so important to make sure we're monitoring fluid and electrolyte status to make sure she's keeping those elevated. And for her electrolytes, it was potassium that was slightly elevated. So again, just monitoring for renal and GI losses as well. The liver enzymes, on the other hand, were slightly elevated. This just might be from the stress on her body as well as all the medications she is receiving for treatment as well. So she is experiencing severe protein calorie malnutrition as related to inadequate oral intake, increased metabolic demands from the present infection, as well as nutrient loss because of the Crohn's disease that she had prior with the ileal resection and the small bowel resection. It's pretty evident by the BMI of 17.4, as well as the 16-pound weight loss in the span of 3 months. She also has hypoalbuminemia and muscle wasting. Now, with the nutrition management, I felt it was pretty important to make sure that she was getting the protein since she lost such a significant amount of weight. I was pretty stuck just because with the options, Juven, Jevity, Promote, and Vital, just trying to take into consideration her vegan diet, it was hard to find something that didn't contain milk products in it. So Juven was the only one that didn't contain any of that, but it was so low in protein, I believe only 2.5 grams. So I did feel more comfortable going with Jevity just because that also provided a pretty significant amount of protein. So specifically the Jevity 1.5, because it does provide the 1.5 calories per milliliters, kcals per milliliters, along with 63 grams of protein per 1,000 milliliters. So I felt that was pretty important. The total volume that I concluded would be best would be the 1550 milliliters per day at a rate of 65 milliliters per hour for the 24-hour span. With that, the calories provided would be 2,340 calories per day, and the protein at 98.3 grams per day, which ended up being ideal just because I wanted to make sure she was getting at least 80 to 100 grams of protein a day. So that was just what I felt would suit her best in that condition. Again, I did want to find something that suited her vegan diet a little bit more closely, but I just also wanted to make sure she was ultimately getting the wound healing effects of the high protein and high calorie intake, just because it's important to adjust for the inflammation, post-operative healing, the bowel resection, and the pressure injury that she did have as well. So just in order to promote the wound healing ultimately. So with her progress, she did end up making some pretty great progress. So ultimately, she underwent resection of 22 centimeters of the duodenum and 100 centimeters of the proximal jejunum, which was caused by the extensive necrosis and mechanical obstruction secondary to the Ascariasis infection. Now, post-op, she was admitted to the ICU with a TPN via central line, some support from the ventilator, as well as a nasogastric decompression. It was pretty apparent that the bowel function returned around day 4. So when that was the case, she was extubated. The NG tube was removed and TPN was discontinued at that point. But because of the small bowel resection and her prior history in Crohn's disease with that previous ileal resection, it was pretty important to prioritize the early enteral nutrition. Because of that, the PEG tube was placed to intubate feedings, tube feedings that is. So she developed some complications during that time, which included a stage 3 pressure injury to the coccyx, intravascular coagulation, and fungal rash on her lower extremities. Those were treated with heparin and fluconazole. LC's protein calorie malnutrition in order to support her wound healing and get her ready for that bowel transplant that was scheduled for the Cleveland Clinic. So it's pretty clear she ended up making a better recovery, as evidenced by her 10-pound weight gain, her improvement of strength, skin integrity, as well as her increased energy levels. So to conclude, just to wrap everything up and summarize everything, she is a 32-year-old vegan archaeologist with a pretty complex medical and surgical history, including but not limited to Crohn's disease, multiple bowel resections, and that recent small bowel obstruction due to the Ascariasis. So she was admitted initially with severe malnutrition and complications. Those require pretty intensive care, as well as some surgical intervention and nutrition support. After the resection of the duodenum and jejunum, she did experience some significant nutritional challenges, micronutrient deficiencies, and altered GI function as well. The medical nutrition therapy, including TPN, PEG tube feeding, and transition to a high-protein vegan oral diet, did ultimately lead to her improvement, where she gained those 10 pounds back, improved wound healing. She reported increased strength, vitality. She ended up being discharged in stable condition, with some continued nutrition recommendations, as well as some consideration to her preferences as a vegan and her short bowel anatomy. So, all to prepare her for that bowel transplant. And these are my references. Thank you for tuning in.